let's talk about fatigue. Fatigue is a really common symptom for people to experience when they're also experiencing musculoskeletal pain. And so this is another one of these places where we can use a lot of the context clues and talking about the big picture of people's symptom profile to sort out what's the best path forward. The most common, of course, would be somebody is doing a lot of physical activity, they're doing athletic training of some sort, and they're, maybe in the peak of their training. Of course, they have both musculoskeletal pain and fatigue. That's nobody's surprise there. And that's, of course, somebody that in chiropractic, in physical therapy, we are treating those people on a routine basis. And then there's other people where they may present the same way with various sources of pain and with fatigue, but not have it really be explainable by the things that they're doing. That's where things start to be a little bit interesting. I think an important thing to think about in a situation like this is that we can have two paths going at the same time, one diagnostic and one rehabilitative. So we want people to start to get relief from their symptoms as soon as possible. And of course, when there's a lot of musculoskeletal symptoms, that's something that's right in our bread and butter. That's something that we can treat right away. And simultaneously, we may need to also explain some of the symptoms that don't match up. What is that fatigue if they're not overexerting themselves? Is it an underfueling problem? It's really common for people to slightly underfuel for a long period of time and then hit some sort of blip, like an illness or an increase in training, where suddenly that typically adequate fueling doesn't quite get the job done anymore. Or we might need to dig a little bit more into it and see if there's something inflammatory going on. There are a lot of things that can increase people's fueling needs. But it's really important to remember that we can do both pathways at once, where we're getting symptom relief, we're getting improvements in function, at the same time as we're starting to answer questions and either running labs or making a referral to another specialist to work things up at the same time. We don't always need a very solid answer to every question before we can start to treat symptoms.